I'm Dr. Ed Tyson. I'm a physician who treats eating disorders. I have a private practice called the Medical Center for Eating Disorders in Houston, Texas. I see people with eating disorders of all types. Depending on severity, I will be able to treat them as an outpatient with a treatment team. But some, of course, are beyond that and need more help. Then I start looking at the higher level of care called residential treatment. Avalon Hills has always been one of my tops and quite often my favorite because I know the quality of medical care they get. I know the quality of nursing care because I help train all that. I also know that they do things other centers don't do. I mean, they certainly do the family work and they really focus on that. They also do a lot of individual work and of course group work. You know, they'll go on kayak trips, go to Yellowstone, Bear Lake and go swimming Bear Lake, or they get pulled around an inner tube behind a boat. I mean, there's all kinds of things like that. They'll also do things, the usual things like outings to restaurants or other things like museums. And what's good about that, it engages somebody who's been shut down by their eating disorder, where it's been really an isolating illness. It's a very healing thing because it builds trust and exploration to find out who you are. I think it's a great adjunct to treatment. So if people want to learn any more about what I do, they can go to the website of my office. It's Medical Center for Eating Disorders, and the website is med4eds, med4eds.com. I also do a podcast, and it's called Ed on Ed. It's on all of the Apple and Spotify and all the others. And each time we talk about a different subject in very different ways than I think you'll hear from other places. It's very engaging. I think people will really like it. We've got listeners from all over the world now.